I'm Kieran Anderson, group publisher here at Applied Radiology. I am sitting down today with Julie Pekarek, who is the Chief Product Officer at Optum Enterprise Imaging. Julie, welcome to the booth.
Thank you, Kieran.
Looking forward to this conversation. I'm also joined by Dr. Richard Friedland, who's the founder and Chief Medical Officer at Radloop.
Yes.
Is that right?
It is.
Well, thank you as well. You know, we're going to talk today about cloud-native platforms and intelligent reporting workflows and how those are reshaping really the next era of enterprise imaging. You know, it's improving accuracy from what I hear and accelerating communication, helping to address sort of the growing pressures of staffing and obviously this thing that they call burnout. It's real.
It's real.
I hear it's real. So I'm really thrilled to be joined by both of you two to talk a little bit more about this. And why don't we just dig in and start by going around the table, and why don't you tell me about what excites you most at this current moment in like radiology and where we are as it relates to enterprise imaging, Julie?
Honestly, Kieran, what I'm really excited about is the return of radiology as the tech leaders. So we were the tech forward. We started the digital transformation in healthcare. Radiologists were the most tech forward specialty of medicine. And I think with a little bit of the AI and cloud and some of the stalling out of that, other areas of medicine have become a little bit more tech savvy, seen as tech savvy. But now we have really solid use cases and good adoption curves. And I think radiology is back as the tech leaders, and that's exciting.
What do you think, Richard?
Well, I think we're actually at a golden moment in radiology, and that golden moment revolves around alignment. You know, I think healthcare systems, I think vendors, I think radiologists are all very much focused on efficiency, on quality, and how we can, as you said, reduce burnout and at the same time use the tools available to us. Before, the tools were available on an individual basis, an individual practice, an individual healthcare system. When you have a cloud-native system, you now have uniformity. You now have openness. You have the ability to push across, vast numbers of sites to have the same sort of effect on everyone. And again, the patients are demanding these things. The doctors are demanding these things. The healthcare systems are demanding these things. So this is a golden moment of alignment.
From your perspective, right, as a clinician, how has the cloud really sort of changed your practice on a day-to-day basis? What's the most meaningful sort of change that you've seen so far?
I think it's reliability. Again, one of the stresses of being a radiologist is, when I turn my system on in the morning, is it actually going to work? Is it going to deliver what it needs to for me? Am I going to have to call on-site IT, and are they going to be on site, or am I going to have to wait a half hour for them to come in while the cases from the emergency room pile up and everyone's calling me saying, hey, Dr. Friedland, what about my, and you name it. The reliability, the ability to sort of then use other tools to say, okay, I have these other tools available to me that weren't available to me on an individual basis on a site, whether it's looking for pulmonary emboli and the AI tools for that, whether it's looking for fractures when I have 5,000 images and I'm looking at during a trauma case. Each of these things is incremental, but the sum is greater of the parts is greater than the whole. And that's why I think it's so important to have a cloud-based system, because it's actually foundational for all of these things.
And it's interesting, when you try to replace technology, the clinician demands the same feature set, the same performance, the same reliability as they have in their current solution. And cloud solutions have really matured to the point where they can actually create that on-par experience. And I think that's why we're moving to adoption. Another really big consideration is cybersecurity. And I think that there is a higher degree of trust in these cloud solutions, keeping these clinical systems safe and secure. And as people rely more on, the amazing capabilities in a Google or Microsoft or AWS, I think they are trusting the cloud more to have that same experience that they need to have to do their work really efficiently.
You'd agree?
Yeah, I think that word that you hit upon is a very important word, the word trust. I think we've hit an inflection point in radiology where I think a couple of years ago when you said the word cloud, everyone sort of backed away, whether it was the IT director, whether it was the healthcare director, whether it was the radiologist. Will this actually work? Now when you say the word cloud, everyone says, okay, let's go, hit the button, And by the way, it's going to work every time, and I don't have to worry about it, and I don't have to worry about my cases getting lost, and I can share with my colleagues in real time what I need to easily and quickly. Again, it affords just a different level of facility between providers, between patients, between healthcare systems even, as you were sort of mentioning with the CD.
When you're speaking with healthcare leaders today, what is really driving, what they're, thinking about in the system? What are they trying to achieve?
One of the things that I think has changed recently is the current financial pressures are always there, but the current financial situation is very unpredictable. So they are asking me to maximize their investments. They don't want to displace core solutions. They don't want to change an EHR again or a PAC solution again. They want to maximize what they have. And that's why things like AI are so critical, because they can improve the overall experience. They can add automation, they can add efficiency, which they desperately need for their clinicians who are overworked and their admins who are overworked, their IT staff who's overworked. And reporting has been just transformational in AI. Right. It has really added just all the best of the latest AI to improve the efficiency for the clinician. So that's a perfect area for them to make an investment in.
And you've certainly seen the evolution of all of this reporting over the years, Doctor.
I think the inflection point came with structured reporting, right? We began to not think about reports as narratives and how Rich feels today, but data that has to be in the report that we need to think about that goes for each and every patient. And as we begin to move to sort of structured data, that of course allowed us to think about how do we use that data? How does that data actually apply to each patient? How does it apply to any individual patient? We can put quality metrics around that data. We can start to think about what AI needs to be applied to that specific piece of data. We can then do that at scale when we have cloud. I mean, all these things together, again, it's not one thing, but I believe the inflection point was when radiologists began to think about radiology reports, not as sort of a narrative or a discussion, but as this is data about my patient.
Absolutely. And that really ties into another thing I hear often from healthcare leaders, which is they really want analytics. They want to be a data-driven company, and the best way to raise that data is to put it in the cloud. So getting their data, all their imaging data in the cloud is a great first step to meeting the objective of having really good real-time predictive analytics.
So joining us now in this conversation, we've got Dr. Sonia Gupta, who's the Chief Medical Officer at Optum Enterprise Imaging. Dr. Gupta, thanks for joining us. We were talking about reporting and the sort of digital transformation of reporting and really like how that has impacted radiologists on sort of a day-to-day level. From your perspective, would you add anything to that conversation about sort of the transformation of digital reporting?
Absolutely. Transformation is the right word, and I think we're seeing it across healthcare. There's been interest outside of radiology on ambient scribes, and they're recording patient encounters. You're speaking to a patient, getting a good history, and this ambient scribe is listening in the background, and it's able to record all of that information and put it accurately and safely into the patient's medical record. And then we as radiologists are now benefiting from that same technology. We have AI that can generate a draft report for us. It can also help us generate a differential diagnosis, so we don't have to keep looking things up in our resources. And thinking again about the general public perception, everyone is interacting with text-based AI now. We're all talking to ChatGPT and using LLMs in some capacity. So it's only natural that as radiologists, we're always at the forefront of innovation and using technology for patient care. So for us to be able to leverage that for our own reporting is huge. And I'm really excited about that.
And that's a great transition really into sort of radiology burnout and sort of the clinical demands that exist. When you think about which reporting innovations are making the biggest difference for radiologists, particularly with the rising volumes and the aging populations, the chronic disease burdens, what would you say kind of comes to the top?
I think, using AI for reporting does come to the top because we didn't go into radiology to transcribe measurements. We've talked about this before, and a big part of our role is to include those measurements. We need to know if a cancer is getting better or worse. And in order to know that, we have to have measurements in a report. But to be able to have those measurements there the moment you open a report, and you don't even have to think about it, is, again, a huge time saver from a burnout perspective. And, differential diagnosis too. If you think about the cognitive burden of taking care of 100 patients per day and, maybe 10% of those are tough cases, well, now you've got AI as your friend helping you out with your differential diagnosis. So that's another great opportunity for eliminating some of that cognitive burden.
Rich, let's bring you in. Let's talk about some of the tools like speech to report, automated impressions. You talked about structured templates earlier on. How are these kind of changing really the accuracy, the consistency, the workload that you're experiencing in your day-to-day practice?
I think they now and will continue to have an enormous impact on how we practice medicine. And I'll give you a for instance. Not only will we be able to have this sort of speech to report, but also we'll be able to pull in the guidelines. We'll be able to pull in things like quality metrics, things that maybe the ACR has guidelines for pancreatic cysts. Well, not only will we pull that into the report on how often it should be followed up, but the literature that supports that will also be put into the report. So now we have a scientific sort of underpinning for what we're doing. And again, not only are we doing a better job for our patients, but we're letting people understand why we're doing it. So I think there are, on many, many levels, it gives your job more meaning. And again, to sort of beat back the burnout, you have to feel like you're doing something of value.
I think that's absolutely right. I mean, we know there's a burnout epidemic. Over 50% of radiologists are burned out, and any mundane task that could be taken off the plate has enormous day-to-day impact when you think about the number of cases that are being read per day, per week, per month, because we really want to focus on the longevity of the radiology career. We don't want radiologists retiring prematurely or leaving the field, which unfortunately has been something that's been occurring.
Dr. Gupta, when you think about the advantages of a unified cloud, what comes to mind from your perspective?
Yeah, it's that focus on the end-to-end workflow. One of the stressors that radiologists have is you see something on the scan, you report it, but then it kind of leaves you and you don't know if that got taken care of. Did the patient get the next final scan? Did they get another appointment with a specialist? We don't know if that happened or not. And we want to make it happen, obviously, because we want the patient to get the best care possible. And so I think in a unified workflow that's cloud-based, we know you have that peace of mind. And I think that peace of mind when you're going to work every morning, that again addresses that burnout.
As we start looking at the future of radiology and you start thinking about what is 3 to 5 years from now look like, how do you envision workflow, in radiology evolving in that capacity?
I think it'll be more unified, and that's really the goal. I think, as Dr. Friedland mentioned, a lot of these systems were developed in isolation. The EMR was not meant to talk to the radiology IT department necessarily, and maybe the outpatient notes that are in a different computer system weren't meant to talk to the hospital, and everything got kind of disconnected. And now that we have this increased focus on a unified workflow and the information following the patient, or the patient having their information with them all the time, like an airline reservation,
Right.
I think that that's really the hope in the next few years, is this renewed focus on interoperability and just connecting all the dots.
Yep. Your thoughts?
So I think we're going to continue to see intelligent workflows and anticipatory workflows. So what I mean by that is we're already beginning to see cases that become more urgent, things that are in the ER, things where there are terrible things that happen like accidents and brain bleeds are moving to the top of the list. We're also going to see parts of the reports pre-populated that, again, to sort of take away the drudgery of things that are normal and focus on the things where we really need the cognitive skills of the radiologist to parse. I think we're also going to see the logistical burdens and administrative burdens shifted and continue to shift away from the radiologist. And again, we're going to go back to being what I was when I started, which is the doctor's doctor, to go back and talk to people about real problems that patients are having, and the mundane sort of repetitive tasks that I do every day now will begin to move into the background. And I think that's a brighter day for radiologists and for patients, frankly.
One final question. As you think about, healthcare systems and the leaders who are trying to make this sort of transformation within their own enterprises, within their institutions, if you had one piece of sort of advice for them as they sort of like go down this road, what would you say, Dr. Friedland?
Well, I think there are a couple of key pieces. Number one, you have to sort of look at a long-term strategy and an ecosystem. How do you sort of live in the world of unified radiology, in the world of unified healthcare? It's sort of, and who is your partner? Are they trusted partners in this journey to unified healthcare? And the next thing you have to think about is, are they patient-centric, right? Really keeping the providers and the patients at the center of care, which is what we were talking about at the very beginning, aligning everyone, really changes the way we think about our partnership with healthcare systems, with doctors, with our patients. So I think those are the things that, when you think about the journey to the cloud, that you keep in mind, both the platform and the foundation for what you're going to do going forward and what AI systems you're going to use, and then how they're going to interact with the physicians and how they impact patients really are critical to your decision making.
Dr. Gupta, same question, closing thoughts.
I think starting with a governance lens can just set you up for success. Thinking about the governance of a program before you start the program, identifying your stakeholders, do a resource mapping, check out your funding, who do you have to align to get the project to be successful? That planning phase is so important. And, we're seeing a lot of attention now on governance for AI as well, and it wasn't initially probably a thought. It may have been an afterthought, from some of the early adopters, but now, we've got a lot of lessons we can lean on, and now we know that there's a better way to do it, and starting with that governance piece is just the first step. And then I think that does set up a longer term project like moving to the cloud or doing an AI pilot, setting it up for success.
Well, I want to thank you kindly for joining us here at the Applied Radiology booth to talk a little bit about all of these exciting sort of advancements in enterprise imaging and the use of native cloud. Thank you both for your time.
Thank you very much.
My pleasure, absolutely. Sonia, thank you.